Hello, everybody. Thank you so much for joining us for Missouri Rural Crisis Center's webinar on what Medicaid threats mean for Missouri. My name is Dina Vanderzalm. I'm the Community Engagement Director at MRCC. For those of you who are new to us, Missouri Rural Crisis Center is a statewide farm and rural advocacy organization. We got started back in 1985. And we've been working on Medicaid for at least 15 years, from the protection to the expansion and implementation, because we know just how much quality, affordable health care matters for our rural communities. Today, I am thrilled to be joined by Sidney Watson. She's the director of the Center of Health Law Studies at St. Louis University in the School of Law, and has spent her legal career really advocating for low-income people and is quite the expert both in Medicaid and access to care in Missouri. And we're also joined by Amy Blouin, the president and CEO of Missouri Budget Project. Amy's spent 25 years digging in on the state tax and fiscal policy and helping it make it understandable for the rest of us so we don't have to be the experts there. So we're thrilled that both of y'all are able to join us. A couple of quick housekeeping things and we'll jump into it. To give you the lay of the land, we're gonna go over a quick run through of Medicaid basics, what it is, who it serves, how that funding flows, and look into what some of those current threats are, namely budget cuts and work requirements. We are recording this webinar. The recording and the slides will be sent afterwards to everyone who has signed up. And the recording will also be on Missouri Rural Crisis Center's YouTube channel if you want to find it there. We encourage you, we'll try to save as much time at the end for question and answers as we can, but I encourage you to write your questions as you think of them using that Q&A feature down at the bottom of your screen. We'll try to grab those, especially if they're clarifying questions, and address them in the moment, but we'll get to as much at the end as we can. And also thank you to everybody who submitted questions with your RSVPs. We chatted about those as we were getting ready. So we'll try to preemptively address some of your most burning questions. And with that, we'll go ahead and jump into it. I'm going to turn it over to Sidney Watson to get us started.
Thank you, Dina. And my first slide is to remind us all that when we talk about Medicaid, we talk about people. Whenever we talk about health or healthcare, we talk about people. And if we go to the next slide, I want to begin by talking about who are the people that Medicaid covers. It's seniors in nursing homes, low-income children and their parents, pregnant women, people with disabilities. It's people like my friend Chuck, who in his early 70s suffered a series of strokes. And near the end of his life, he was first in a nursing home and then was able to end his life in home care in the community, able to continue to see his wife, June, because of Medicaid. Medicaid paid for his nursing home care and his home care, and Medicaid made it possible for his wife, June, to keep working as a hairdresser and to continue to stay in their family home and have that family home, and for Chuck to have that dignity in the last years of his life. Medicaid is important. It covers about half of the people with disabilities, both children and adults. And beginning in 2021 in Missouri, we expanded Medicaid to include low-income workers. We voted on a constitutional amendment. We passed a ballot initiative that enshrined Medicaid expansion in our state constitution. And now Medicaid in Missouri covers people who don't get insurance through their jobs, who can't afford to pay out of pocket for medical care or buy insurance. They're moms with young children, they're caregivers, they're delivery people, they're wait staff, they're seasonal workers. They're people like Caitlin, who you see here in this picture, and his mom. Caitlin has type 1 diabetes, and he's able to get Medicaid. And because of Medicaid, his mom, Sally, says that Medicaid saved Colin's life when he was in the ER and able to get his drugs. And lots of people in Missouri depend on Medicaid. I'm going to tell you a little in the next slide about the beginnings of Medicaid and how it's financed. Medicaid dates from 1965 when we enacted Medicare. It was a package deal. Many of you may be on Medicare, like me, which is a fully federal program. Medicaid is a federal state program. It's voluntary for states, but what the federal government does is offer states funds, and if states, and all states do want to participate, they get those federal funds to help cover health care for low-income people in their states. Congress passed Medicaid in 1965 because it knew that states did not have the financial resources to cover things like nursing home care, which is not covered by Medicaid. And states don't have the money to cover other kinds of health care for low-income people. That Medicaid federal money makes that possible. In Missouri right now, the federal share of Medicaid covers 70% of the cost. For most services that Medicaid covers, like nursing home care and prescription drugs, the federal share varies by states. Lower income states like Missouri get 66% federal, while higher income states get less federal support because they have more tax dollars. So if you are across the Missouri River in Illinois, Illinois gets a lower federal match. It's 42%. For those Medicaid expansion working age adults, the federal government covers even more. It's 90%. And one of the things we know about expanding Medicaid is it's brought substantial additional federal dollars into Missouri that not only support health care, they also support our rural hospitals, our community pharmacies, and our primary care system. Another important thing about Medicaid that dates back to 1965 is that there is no cap on federal funding. And that's really important because when there is a tornado in Joplin and a lot more people in that part of the state who need Medicaid coverage, we can depend on that federal match to cover Medicaid. It also means that when there's an economic downturn like there was during COVID, that the federal share steps up when it's hard for us to cover the cost here in Missouri on our own to make sure that Medicaid is there when people need it. And another thing to know about Medicaid is that states have a lot of flexibility. Unlike Medicare, where the rules are the same wherever you live, Medicaid is state administered and state designed, as long as they do it within federal law. So there are a lot of things that are unique to Medicaid here in Missouri that'll look different than if you lived in Kansas or you lived in Arkansas. And one of the things that states have the flexibility to do is to decide who is eligible for Medicaid, because it is a program that does have a means test and there are maximum income levels for people. And so on the next slide, I want to talk a little bit about that. And I'm going to start with that box in the middle that talks about seniors and those with permanent disabilities. So people who are 65 and older or who have a permanent and total disability can earn up to $21,000, almost $22,000 a year and qualify for Medicaid here in Missouri. Many people and seniors, people with disabilities and seniors can qualify at even higher incomes, but they have to pay a deductible. We call it a spend down, but it's really important because this is the way a lot of people qualify for nursing home care through Medicaid. They contribute a substantial part of their income in return for getting that nursing home care. The income limits for children, and the numbers I'm giving you here are for a family of 3, are $77,718. That's a higher income level. Our legislature decided we wanted to have more expansive income guidelines for children because we know that when children get the health care they need, they grow up to be healthy adults and productive adults. The income limit for pregnant women is $51,898 a year. That's a family of 3, and a pregnant woman counts as a family of 2, she and her child. And over on the left-hand side is that category of Medicaid expansion for adults. And that income limit for a family of 3 is about $35,000 a year, and includes working folks. If you go to the next slide, I've got some examples of the kinds of people here in Missouri who qualify for Medicaid expansion. Brenda and Danny are from the southern part of the state. He's a sawman in a mill, and Brenda works as a home health worker. Danny works seasonal work because that sawmill's not always open, and they qualify for Medicaid because of Medicaid expansion. Sarah is in her 20s. She's 28. She's going to school part-time to be a social worker, and she is able to be covered by Medicaid expansion too. Lisa, you'll see over on the right-hand side of the screen. Lisa is a mom. She has 3 kids. She works full-time as a cashier in a small town here in Missouri, and she also works part-time when she can. None of her jobs offer health insurance, but Medicaid expansion offers coverage. One of the things to realize about Medicaid, before I hand it over to Amy to talk a little more about the numbers here in Missouri, is that Brenda and Danny and Sarah and Lisa are all U.S. citizens. To qualify for Medicaid expansion here in Missouri and elsewhere, you must be either a citizen, a long-term lawful permanent resident, for example, somebody with a green card who's been here at least 5 years. And in some cases, recent refugees and asylees can qualify for Medicaid. But most recent immigrants and no undocumented immigrants can qualify for Medicaid here in Missouri. But let me turn it over to Amy to talk a little more about what this means in terms of big numbers.
Thanks, Sydney. It's good to be with all of you today. I'm going to run through some of the budget numbers very briefly. Sydney covered some of this stuff too, but just to give you a better sense of what we're talking about before we talk about proposed federal cuts to the program. The federal funding in Missouri makes up about, right now, over 63% of the funding for Medicaid in the state. The other funding, general revenue in the pie chart, is what you think of when you think of state taxes. So state income tax, state sales taxes all go into a bucket called state general revenue funding. Missouri pays just 14% of the total cost of Medicaid out of general revenue funding, making it a really, really good deal for the state of Missouri. And that's because, as Sydney mentioned, the match rates, the federal government puts in a lot more funding, depending on the program, anywhere from 65% of the cost to 90% of the cost. And we also have what's called the federal reimbursement allowance, also known as provider taxes. And that allows hospitals and other providers to contribute a portion of the funding that they receive from Medicaid for serving Medicaid patients to a bucket of funds that then leverages federal money. So that bucket in Missouri for hospitals, it's a $1.5 billion contribution to support Medicaid, which means we can spend less in general revenue. On the next slide, it's also important to know, where the money goes. And as Sydney said, obviously this money goes to hospitals, it goes to your doctor, it goes to nurses, it goes to pharmacies. It keeps the healthcare infrastructure flowing in communities throughout the state for all of us. We're able to access hospitals in rural areas because of Medicaid, because Medicaid makes up a significant portion of their full budgets. But what's also important to know is that the cost of different populations in Medicaid, covered by Medicaid, is different. You know, kids and parents make up 81% of the population. These are kids, parents, and other adults, make up 81% of the population covered by Medicaid, but they account for about 50% of the cost. You know, that is because they are cheaper, less expensive to cover than folks with disabilities and older adults. Older adults and people with disabilities, though they make up about just 19% of the Medicaid population, they account for nearly 50% of the cost. So when we get into talking about the federal proposals and the changes and the cuts that could be made, it's important to recognize that there is no way that cuts could occur without impacting older adults and people with disabilities. Nobody could be protected in the scenarios that the Congress is considering. And so the next slide, I just want to point out how much Medicaid means to rural communities in the state. In urban areas, about 18%, 18.5% of the population is covered by Medicaid. In rural areas, it's closer to 26%. So it's 1 in every 4 people living in rural communities are covered by Medicaid. The image on the right side of your screen, the darker areas of the state are where you see higher portions or percentages of kids covered by Medicaid. And those very dark blue, it's 50% of kids. So 1 of every 2 kids are covered by Medicaid in rural, in southern rural Missouri. So the next slide, let's get into talking about what the federal proposals are. Congress is considering a package called the Budget Reconciliation. And in that package, they want to pass both a significant tax reduction that is largely focused on very wealthy folks, but they want to pay for that with cuts to services kind of across the board. But the proposals specific to Medicaid are huge in context. So the cost, one of the proposals, for instance, they're looking at a $1.2 trillion tax reduction. The Medicaid area healthcare costs they're looking at cutting those by $880 billion. So a large portion of the payment, if you will, for enacting the tax reduction would be paid for by Medicaid reductions. These 3 issues that you see on your screen are the ones that have been lifted up. They're the ones that are at kind of the primary focus of what Congress may do. They're looking at changing the matching rate that Sidney talked about very well and reducing that match rate, both for the Medicaid expansion population and for other populations. So if they were to reduce the Medicaid expansion matching rate, we'd be going from 90% federal payment down to 65% federal, which means the state would need to pick up at least $800 million per year. There are 326,000 Missourians who are at risk of losing healthcare because of that change, assuming that the state would not be able to pick up that $800 million cost. The other thing that they're looking at is reducing the provider tax and what's allowable for the provider taxes. As I mentioned, the hospitals contribute and other providers contribute a portion of the funding that they receive for caring for Medicaid patients. In that portion of the funding, they're currently allowed to go up to 6%. And that money is used to leverage federal funds. That could be cut in half. And that would cost Missouri another $750 million per year. Some of these things are a little bit fungible. Some of the numbers are fungible. Different proposals are floating around. So in some analyses, they've estimated that we're looking at a $2 billion cost to the state of Missouri per year. that 2 billion, just to put it in context, would be 2 billion of our general revenue funding. Currently, the state only brings in slightly more than 13 billion in general revenue tax dollars. So you can see we don't have the ability to make up for that with our existing pool of funds that we have available. We also cannot deficit spend like the federal government can. So this would require significant cuts to Medicaid. I know Sidney is going to talk a lot more about work reporting requirements. I will say that just that 36% of the adults covered by Missouri Medicaid are at risk of losing coverage under work reporting requirements. It will also have a significant cost to the state. Those requirements create a need for additional bureaucracy, and Missouri will have to pay for that. Some estimates indicate that the combination of increased bureaucracy to be able to process these new reporting requirements and the increased work support costs would mean that we're looking at hundreds of millions of dollars a year in state expense that would not be covered by the federal government. So all of those things combined would be a really hard hit for the state. Going to the final slide, my final slide, there's some urgent messages for our lawmakers about not cutting Medicaid, protecting Medicaid, that you can share with your lawmakers, right now, that Missouri can't afford to replace those federal funds, which means that any reduction to federal funding will result in the loss of healthcare for Missourians. The magnitude, the size of the cuts means that we're not going to be able to protect a particular group. We're not going to be able to protect kids. We're not going to be able to protect adults. We're not going to be able to protect older adults, seniors, and people with disabilities. And I believe Sidney covered this, but nearly 2 in 5 kids in rural areas, 1 in 8 adults, 100,000 older adults, which is 9% of seniors, 2/3 of nursing home care. All of that is important, really critically important for our lawmakers to hear. This is what we mean by Medicaid, those people. So I'll pass it back to Sidney to talk more about work requirements.
Thank you, Amy. We hear often that people who get Medicaid should work. And I just wanted to make sure that everyone understood that the statistics tell us that 9 out of 10 adults with Medicaid are working, caring for a family member, in school, or have a disability that prevents them from being able to work. The other one are people who have recently lost a job, who are looking for work, who are between work, who are like Danny, who work seasonal jobs and know they're going to be out of work for a couple of months, but will be back in the workforce. The problem with work reporting requirements is to require work requires people to file reports every month about who they're working for, what they're making, in many cases, how many hours they're working. And that's paperwork that can get lost, computer programs that can fail, problems when employers don't fill out or sign paperwork that's needed, and backlogs and log jams that happen when states don't have enough workers to process all of these monthly reports. That photograph at the bottom of my slide is Adrian McGonigal. He's from Arkansas, and he'd been working 5 years in a chicken plant when he became eligible for Medicaid expansion, which covered the prescription drugs he needed to stay healthy to work. He thought he had filled out an online form on his app on his phone, and he'd done everything he should have to report his work requirements. But he found out when he went to the pharmacy and couldn't get his prescription filled that something had gone wrong and the state had never received his form. He couldn't get his prescription drugs. He got sick. He ended up in the emergency room. He missed work and he got fired. And that's the problem with work reporting requirements. They create barriers to work, barriers to care when they're about a myth. And let me show you the next slide here and talk a little more. Arkansas is the only state that's actually implemented a work requirement for people who qualify under the Medicaid expansion. In the first 7 months of their requirement, 18,000 people like Adrian lost Medicaid coverage. That was 1 in 4 of the people subject to the requirement. And many of those were people like Adrian who were working. The statistics, the research showed us that Arkansas's effort did not increase work participation because people were already working. The problem was they couldn't get the paperwork in. What we also learned from Arkansas is people ended up uninsured. They weren't able to get back on Medicaid. They ended up in emergency rooms. They got sicker. After a few months, a federal judge shut down the Arkansas experiment. But what's going on in DC right now is an attempt to bring it back and to bring it back on a national basis. It was a failed experiment. We'd like everybody to have a job, but we'd also like people to have health insurance. And what we know is that Medicaid expansion allows people to get the health care they need, to get healthy, and that having Medicaid expansion means more people are in the workforce because more people are healthy. And I think Dina's going to open it up for some questions now.
Absolutely. And we have one question that is about Missouri specifically because of our constitutional amendment that was protecting against requirements, the way that was written. So how could that even work or look in Missouri, given that?
Yeah, that ballot initiative I mentioned has a provision in it that says our state legislature or our state Medicaid agency cannot impose any more restrictions or eligibility requirements or conditions on Medicaid expansion adults than they impose on other groups like seniors, people with disabilities, children, pregnant women who qualify for Medicaid. I certainly think that that means that Missouri can't impose a work requirement. However, I have real concerns that if this bill in Congress passes, what we'll see is a real push to change that constitutional amendment, or we'll see some kind of, well, let's pass something that applies to seniors and children, but we'll have exemptions and you can all file for your exemptions. And that's going to be a whole lot more paperwork and a whole lot more people who get hurt.
Absolutely.
So thanks for knowing that there's that protection out there.
We love our informed voters. I do want to just keep a look at time. I know we've got a couple of other questions, but we can circle back with folks afterwards. We'll keep your questions. We did want to make sure that we show you the good news that because a lot of this is pretty scary. There is stuff you can do. You can do right now. That's the silver lining. In fact, there's 3 things because everything is more magical in 3s. So as Amy mentioned, right, call Congress. They need to hear from us, from all of us right now, that Medicaid funding shouldn't be on the table. So we've listed 2 numbers here. And again, we will share these slides afterwards. So you'll have those numbers in the slides from Amy of some of those statistics if you want to pull those out. If you have a personal story, those are always powerful to share. But the big takeaway we want them to hear is absolutely, we do not support cutting money from Medicaid. There's a number for the Capitol switchboard to get directed to your person, both for you to call at 202-224-3121 for a voice connection. And for the teletypewriter, the TTY, the number is 202-224-3091. And then spreading the word is the rule of the day here, right? We need as many people to know about this as possible. That includes your communities, your neighbors, your family and friends, and your elected officials here, even at the state level. We need them to be arguing on our behalf up to the federal level too. So we'll be hosting MRCC will be hosting a letter writing campaign little workshop. So whether you've never written a letter to the editor or you've done a bunch, it'll kind of have something for everyone, and I will include a link for that RSVP when we send the email out. But some tips and training at the beginning if you're new to it, or just co-writing workspace if you just need to hold the time on your calendar. That's something that's helpful for me sometimes, just get it done. But lifting up voices across the state is our goal there. And then we will be doing phone banks at MRCC. So if you would like to do some of our volunteer phone banks, that's Missourians talking to Missourians, making sure people know about this and that they feel empowered to take action to stand up for themselves and their rights. Again, just email me, Dina, that's DINA @morural.org. And I wanted to make sure we gave our experts here a chance to say your final thoughts here. So I will start with Sidney, if you have any final takeaways for folks.
Please call your congressman. Please write a letter. This is the most serious threat we've seen to Medicaid in 50 years. Congress has never cut that federal match. Over the years, it's increased it several times. Medicaid survives because it is a joint federal program, and we need the feds to live up to their deal.
And Amy?
I would just say thank you. Thank you for caring about this, and thanks for all of your advocacy.
Absolutely. Well, thank you everybody for joining us. And most importantly, thank you for taking action to help us protect Medicaid. And we will catch y'all next time. Thank you, everyone. Have a good afternoon.